Hi, everyone. Good morning. Thank you so much for joining our health chats today. We'll be talking about breast cancer awareness. And first, I actually want to, thank our sponsors who are Elite Medical, Cyan, CVS Caremark, Plantel, and HCP National. So thank you so much to all of you who make this possible. I'm going to go right ahead and jump into the presentation. We'll probably have about 15 minutes of content today, and then we'll leave a few minutes at the end for Q&A. So for those of you who don't know me, I'm Rosemary Ku. I'm our United Ag's Chief Medical Officer, and it's a pleasure to talk to you today about breast cancer awareness. So the first thing we're going to go through is just some basic data on how breast cancer is impacting our daily lives. We'll go through some common myth busters. I'll talk about cancer prevention, and then we'll have time for Q&A and go over United Ag resources. So first of all, so here is actually a picture of what a mammogram looks like. And you can see the circle around a little area of cancer. And, cancer, a tumor, as little as this can spread to the rest of the body and cause a lot of harm. We all know that breast cancer is life-threatening. It's actually the most prevalent cancer worldwide. It's the second leading cause of cancer death among women overall, but among Hispanic or Latino women, it's actually the leading cause of cancer death. So unfortunately, in our communities, our women who get breast cancer, unfortunately, have worse outcomes than women in general. 13% of the women in the US are expected to develop breast cancer at some time in their lifetime. So that means if you know of 8 women in your life, your mother, aunts, friends, etc., if you know of at least 8 women, one of them will get cancer in their lifetime. This is pretty staggering because I think a lot of us know certainly at least 8 women that we care about. And most of us will be touched by breast cancer, either in ourselves or in our families and loved ones at some point. Just to remind you guys of the U.S. Preventive Services Task Force screening recommendation, this is the most important thing to do to catch cancer early, to ensure that if you do have cancer, that you can survive from it and that your life expectancy isn't impacted by it. And that the recommendation is for women who are 50 to 74 years old to have a screening mammogram every 2 years. And this is a bit of a change over the last several years. Several years ago, the recommendation was to start at age 40, actually, but since then it's changed to start a bit later at age 50. However, if any of you have risk factors for breast cancer, which we will go over, you might actually need to start at an earlier age, such as 40 or earlier. So it's really important to develop a personalized cancer screening plan and schedule with your doctor who understands all of your own personal health risks. So the first myth that I'm going to go through is that self-exams are good enough to screen for breast cancer. Now, a decade or so ago, breast self-exams were taught to patients. They were taught in schools even. I remember, being taught this as a young girl about this is what you have to do to stay healthy, is to, check your breast yourself to make sure that you don't feel any lumps. Well, over time, this has actually been no longer recommended, meaning that you don't have to, you yourself are not necessarily the best judge of you don't have to systematically, routinely check your breasts. That's often led to false positives that have led to a lot of diagnostic tests that can actually harm people and certainly cause a lot of psychological distress. And so the medical community found no evidence that women need to do regular self-exams to improve outcomes. It just didn't improve outcomes. However, Instead, we're really focusing more on breast self-awareness. So instead of regularly doing breast self-exams, just having a general awareness of your breast size and shape, and noticing differences if they happen over time, is really more important than doing the very detailed exam on a regular basis. The second myth that I'm going to go through here is most women feel that if they don't have any symptoms, they feel well. They don't need to get screened for breast cancer. So even if they're in that age group of 50 to 74 years old, they might not get their screening mammogram because they feel well. But the fact is that many people with breast cancer don't have symptoms at all. And this is exactly why we have a widespread breast cancer screening program, is that every woman in the age range needs to get the mammogram because breast cancer doesn't always present with symptoms. On the flip side of that, you can have a lump, but it might not be breast cancer as well. So symptoms are not necessarily the best judge of whether or not you might have cancer. So that's why it's even more important to get your regular screenings done, even if you are feeling well. However, I do want to go over some really important warning signs that could be indicating breast cancer. And these are actually warning signs for both men and women. Men can get breast cancer as well. It's much more rare, but they can, and they can also have symptoms like this. So the things that you want to watch out for are lumps or pain in the breast area, the nipple, or the armpits. If your breast size changes shape, or it's getting larger in a certain area, or becoming more asymmetrical, those are really important signs to talk to your doctor about. The nipple can actually change in breast cancer as well. So usually nipples stick out, but if they change shape and actually invert instead, that could be a sign of something happening in the breast tissue. Skin changes can also indicate breast cancer, especially inflammatory types of breast cancer. And what I mean by skin changes are redness or dimpling. So there is a certain sign of breast cancer that's when the skin of the breast actually looks like an orange peel, like it kind of becomes dimply, like the pores become, more pronounced and the skin is less smooth. And literally it looks like an orange peel. And that is a sign that could be breast cancer. And certainly abnormal or bloody nipple discharge is something that you should absolutely talk to your doctor about. And mind you, these are signs that even if you've had a recent normal mammogram, it's still important to talk to your doctor if you develop any of these symptoms in between your normal screening mammograms as well. I actually saw a patient, a middle-aged woman who actually was totally up to date with her mammograms, had her last mammogram even a few months ago, but she came to see me because she noticed a lump in her armpit. She actually thought it was an ingrown hair or maybe a lymph node, but it wasn't going away. So she thought she should come into the office. And it actually turned out to be breast cancer that had spread to her armpits already, even though she had a recent normal mammogram. So the mammograms aren't perfect. They're a great screening tool, but if you have any of these symptoms, don't discount it, even if you've had a normal mammogram, or even if you're young and you have any of these symptoms, you're not even in that screening age range yet. And if you have these symptoms, you should go see your doctor as soon as possible. Okay, the third myth that we're going to go through is if breast cancer doesn't run in my family, I won't get it. But the fact is that the majority, 85% of breast cancer cases are in people who have no family history at all. So most people who develop breast cancer have no family history of cancer, or certainly not breast cancer. However, if you do have a family history of cancer, either that's breast, ovarian, uterine, or any other type of cancer, it's really important to tell your doctor about it because they might suggest earlier or more frequent breast cancer screening. So again, going back to what I said earlier is, partner with your doctor to develop your own personalized screening plan. The additional risk factors that can put people at higher risk of developing breast cancer is dense breasts. So for women who have more connective tissue in their breasts, the mammograms actually show up as brighter. So remember earlier we saw that image of the very small breast cancer. It was kind of bright and white on the mammogram. For women with dense breast tissue, a larger portion of the breast looks like that. So one, it's harder to see small cancers, but also the increase in breast density, to our knowledge so far, seems to also be putting these women at higher risk of developing cancers. So if you have been told, or if your doctor notices on the mammogram that you have dense breasts, you might actually need additional screening diagnostics to make sure that you don't have breast cancer. Those can include MRI or ultrasounds if the mammograms aren't good enough to make sure that you don't have any cancer tissue. If also your menstrual and reproductive history can impact your risk factors. So if your period has started early and ended late, so you have a longer period in your lifetime of being exposed to female reproductive hormones, then you are at higher risk. This also means if you've had your first child later in life, above age 30, you might be at higher risk of breast cancer as well. Not breastfeeding can also put some women at higher risk. And any medication, radiation, or chemical exposures that are unusual, please talk to your doctor about. The medications specifically are those related to hormone replacement therapy that you want to make sure your doctor is aware of, because you might need a different screening regimen in that case for breast cancer. And in addition, an unhealthy lifestyle, which we're going to talk about next, and what to do about lifestyle ways to minimize your cancer risk. An unhealthy lifestyle can also increase your risk of breast cancer. Okay, so those were all the main myths that I've heard from patients and kind of seen in the media. We've already kind of debunked those, but now I want to kind of pivot into kind of what are the lifestyle things you can do to decrease your risk of developing breast cancer. And these tips actually apply to really any kind of cancer as well. And the first is to maintain a healthy weight. And now this, mind you, this doesn't mean to be as skinny as possible. A healthy weight for you might not even be in the normal BMI chart if you have a lot of muscle. And so things that indicate that you are at a healthy weight is that you don't have any other medical conditions that suggest that you are weighing too much. So for instance, things like prediabetes might indicate that you're carrying too much weight. High blood pressure might also indicate that you're carrying too much weight. And so, talk to your doctor about what is an ideal weight for you, and try to achieve that or maintain that as you get older. The second thing I want to talk about is stress management and adequate sleep. These might seem like, not that important for everyday life, but these actually have, both sleep and stress have a really big impact on your immune system. And people don't often realize that your immune system is it's one of the main ways in which our own body fights our own cancer cells. So each day when new cells are developing, they can accumulate mutations that cause them to reproduce faster and ultimately develop into tumors or cancer. Now, your immune system is surveilling these cells of your body to make sure that they're not doing that. But if your immune system is not functioning well because you're under a lot of stress and because you're not sleeping well, then your body doesn't catch those very early cancer cells. And so anything that you can do to improve your immune system can actually help you prevent cancers as well. Tobacco and excessive alcohol are really important for to avoid these, to reduce your cancer risk, because both of these, so tobacco actually includes carcinogens, so that can directly cause cancer, but both of these also cause a lot of inflammation. And inflammation in the body can actually directly, hurt your DNA, so it can actually make mutations more common. And so cancer is ultimately the result of mutations that happen in your cells. And both of these two, the tobacco and alcohol, can increase inflammation in your body that could increase the risk of mutations that lead to cancer. And then lastly, as I mentioned, talk to your doctor about any medications or exposures that increase your cancer risk, so that you can get screened earlier or more often. Okay, and then with that, I do want to review our United Ag resources. So that includes teledoc. So if you have any of those symptoms we talked about earlier that are warning signs of cancer, you can certainly reach out to teledoc for really basically immediate assistance for them to help triage you. You can also come to our website for additional information, and our health and wellness centers are available to you. Certainly if you have any acute symptoms, but they also can serve as your primary care doctor as well. So I've mentioned a few times about developing your own personal cancer screening schedule and plan based on your own risk factors. Our health and wellness centers can do that for you, because they don't just see you when you have pain or have acute symptoms. They can actually follow you over time and help you with your own preventative care. So with that, we'll open it up to the audience for any questions. So if you have any questions, go ahead and chat them in. Okay, great question. We got a question in that asks, should men get screened for breast cancer? As you probably noticed during this presentation, I really focus on women in that age range of 50 to 74 who really need to get screened for breast cancer. And men do not need to necessarily be screened for breast cancer, because it is so rare in men. It doesn't really make sense for men to get regular screening modalities. So that's why I do want to emphasize that breast cancer can still happen in men, and to watch out for symptoms, but men don't necessarily need to be screened on a regular basis. Great question. Any other questions? All right, great. Well, it was a pleasure talking to you all this morning. Next month will be Diabetes Awareness Month, and we'll either have another webinar like this, or actually we're thinking about bringing back Lulu Toar, who is our functional medicine expert. So she'll either come back next month or the month after. So either you'll be hearing from me or from her, but regardless, it should be a good conversation coming up next month. So thank you all today for joining, and I'll see you next time. Bye-bye now.